Okay. All right, we are going to go over our head to toe assessment. My name is Bethany. I'm going to be doing your head to toe assessment. The first thing we're going to start off with is the facial part of the assessment. We're going to go ahead and assess the facial nerve, which is cranial nerve 7. I'm going to do this by checking the motor functions of that facial nerve. So I'm going to just run you through a series of tests, and you're just going to follow the commands. So go ahead and smile real big and show us your teeth. And I want you to go ahead and wrinkle your forehead real. Okay, great. And close your eyes real tight, and then open them real big as you can, and then puff out your cheeks like you're blowing on something. Okay, great. So cranial nerve 7 is intact. The next thing we're going to go ahead and assess is I'm going to go ahead and palpate the temporal artery over here, and I'm going to go ahead and palpate the temporal mandibular joint. I'm going to go ahead and have you open and close your mouth. Is there any pain when doing that?
No.
No, so no pain, that's normal. And then I'm going to have you go ahead and clench down real tight, and I can feel the muscles here. We're assessing trigeminal nerve 5, which is cranial nerve 5, the trigeminal nerve. The next thing I'm going to go ahead and have you do, I'm going to check for a sensation, which is also trigeminal nerve, cranial nerve 5. So just let me know if where I'm feeling, or don't let me know where I'm feeling you, but let me know if this feels the same on both sides. Feels the same? Okay, so that all feels the same. So cranial nerve 5 is intact. The next thing I'm going to go ahead and do is I'm going to go ahead and palpate the facial sinuses. So I'm going to take your glasses off for a second. I'm going to go ahead and palpate the frontal sinuses here, and any pain when I'm touching you. Maxillary sinuses here, so no pain. Now we're not going to test for the ethmoid or the sphenoid sinuses because those are a little bit deeper in the face and we're not able to. So you can go ahead and put your glasses back on. So the next thing we're going to also assess is the neck, and we're going to go over the neck, and basically we're going to start with just some basic movements. So we're going to start with flexion, which is causing your chin to your chest. Okay, so go ahead and put your chin to your chest and back to normal neutral position. This is extension, and then hyperextension is when you tilt your head back. Go ahead and tilt your head back. Is there any pain with doing this? No? Okay, so here we're assessing cranial nerve 11, which is the spinal accessory nerve. The next thing I'm going to have you do is do some lateral bending, so just go ahead and tilt your head to the left and neutral, and then to the right. Any pain when doing those movements? No? It's okay, so cranial nerve 11 is intact. And another way I'm going to test cranial nerve 11 is by you pushing against my hand. You're just going to turn your head to the left against resistance. Good. And then to the right against resistance. Good. And we're still assessing cranial nerve 11, the accessory nerve. I'm going to have you shrug your shoulders up and try not to let me push them down. Okay, that's good. All right, so as far as the neck, cranial nerve 11 is intact. We're going to go ahead and I'm going to assess the lymph nodes in the neck area. So we have the preauricular lymph nodes in front of the ear, the postauricular lymph nodes in the back. We have the occipital lymph nodes in the back of the head. You have the tonsillar lymph nodes, and we have the submandibular lymph nodes and submental lymph nodes. We have the anterior cervical lymph nodes, posterior cervical lymph nodes in the back of the neck, and the supraclavicular lymph nodes. I don't feel any lymph nodes present, no pain, no tenderness when I'm touching, correct?
No.
No. Okay, great. So the next thing we're going to assess in the neck is the trachea. The trachea appears midline. I don't see no deviations, no shortness of breath or anything like that. I'm also going to go ahead and assess the thyroid gland. So by doing this, I'm going to go ahead, come from behind the patient and just palpate the thyroid. I don't feel any nodules or goiters in the thyroid. Any pain when pressing?
No.
No. So the thyroid gland is good. The next thing I'm going to go ahead and do is do a breast exam. You can step aside. I'll go over the breast exam myself. So every patient deserves a self-breast exam or needs to have taught how to do a self-breast exam. It is also important to have a model or to help demonstrate the self-breast exam. I'm going to do it on myself here. So the first thing I'm going to teach is to interlace your fingers and put them behind your head here. When you push kind of on your head and raise your arms with your elbows bent, it causes your breasts to lift up. You're going to look at both breasts, they look symmetrical. You're going to look for any tenting in the breast skin or any kind of dimpling or in the skin area. It should be symmetrical. The next thing you can do is put your hands on your hips and push down, which also causes your breast to move a little bit more outwards this time. And once again, we're looking for symmetrical the way the breasts move, and we're looking for the skin, the elasticity of the skin, make sure it looks flat and normal and there's no dimpling or ruffles in the skin area. The third thing we're going to test for the breast self-exam is by putting your hands on your hips. And same thing this time, but we're going to lean forward. And here you're going to assess for the way the breasts fall. They should fall symmetrically. And once again, we're paying importance to the skin around the breast area. With the breast, there are lymph nodes in the breast and axillary area. There's 5 lymph nodes. So we're going to go over those real quick. So you have the central lymph nodes, which go along the subclavian vein. You have the pectoral lymph nodes. And then a little bit to the outside would be the subscapular lymph nodes. And then you have the lateral lymph nodes a little bit below that. And then you have a brachial lymph node in your arm. It's very important to teach patients to check the lymph nodes for any bumps, and not only their breast area, but in their armpit area. This area is called the tail of Spence, and it's normal breast tissue, but it grows up into your armpit area or axillary area. And the reason it's so important to check that area is because most breast cancers grow in the upper area of the breast, more on the outside. So it's good to palpate for any kind of masses, nodules, or swollen lymph nodes. So we're going to go over some concerning masses that you may see in your breast. Anything that would be, any nodule or mass that you feel in your breast should be pointed out to your primary care doctor. That way they can order additional testing if needed. Some things that are not good to see would be any kind of irregular shaped mass, a mass that is very non-movable, very fixed to the area. Any mass that is tender or any mass that's growing in size would be a concern. And then, of course, we're going to go over some risk factors for breast cancer. Some risk factors for breast cancer would be alcohol use, smoking, hormone replacement therapy, and prolonged birth control, as well as like a family history of breast cancer would be some risk factors. Matt, if you want to come back, I'm going to do the neurological assessment. No ice cream. Okay, we're almost done. Okay, so the last thing we're going to go over is the neurological assessment. So basically, I'm just going to check his mental status and ask you a few questions. So can you tell me your name?
Matthew Christensen.
Okay, and what year is it?
2020.
Okay, and where are you at right now?
Ocala, Florida.
Okay, so he's alert and oriented to person, place, and time. No speech or anything noted. I don't see any difficulty speaking. I don't see any acute distress noted. So GCS is 15, that's normal. The next thing we're going to go over is something called the Romberg's test. This basically is going to test for someone's balance and accommodation. When patients are, I'm going to have you stand over there in just a second, but I'm going to have you close your eyes. When you close your eyes, you're checking to see if a patient either leans from one way or the other, or they have a drift in their arm, which would be a positive Romberg's test. So if you want to go ahead and stand right over there. How would I flip this?
Tap the screen.
Yeah.
What's
This
that button
thing?
do? Double tap the screen. No, double tap the screen.
I don't know how to flip it.
Well, then just spin it around. Just
I don't
spin it-
know.
Yeah. So I'll tell you. Yeah.
Let me know if you can see it.
Yep. Good.
Yeah, you can see you?
Good.
Okay, so you're going to go ahead and feet in normal position. That's good. And then you're going to go ahead and put your arms out by your side up and
Back
palms
up
to
some.
the ceiling.
Back up. Back up. Back up.
Good.
Yeah. That's good.
Okay, and I'm just going to have you close your eyes. And you're going to keep your eyes closed about 5 to 10 seconds. Hunter, get out of the video. Okay, keep your eyes closed. And I don't see any swaying from one side to the other. You can come back, Matt. Actually, we're going to do the gait test, so you see it right there. Another important thing to check for... Matt, get him out of the video.
Cool, buddy.
I'm not doing this again. So there's no swaying from one side to the other. It's very important to stay next to your patient just in case they are having a positive Romberg's test. Anyone with a positive Romberg's test, they're having a hard time accommodating with their eyes closed. So that may be any conditions such as like cerebral ataxia or multiple sclerosis, or anyone under the influence of alcohol would have a problem doing this test. The next thing I'm going to assess is the patient's gait. We're going to assess their balance and coordination. So I'm just going to have you walk normal. And then when you walk back, I want you to walk back with in a heel to toe fashion. So go ahead and just walk normal so I can assess your gait and coordination. Good. And then just, you're good. You can walk back and heel to toe. Okay. So coordination is good, balance is good. They don't need any assistive devices or anything as far as walking and gait. So you can have a seat. Okay, so the next thing we're going to go over is sensation. So basically what I'm going to do is I'm going to have two objects. One is going to be a sharp object, one's going to be a dull object. I'm going to poke you on either side of your body. You're going to let me know where I'm poking you and whether it's a sharp or a dull pain.
Okay.
Any questions? No? Okay, so go ahead and close your eyes and let me know where I'm poking you.
Right arm.
Okay,
Dull
and
pain.
it's a dull pain. Okay, good. Make sure we can see it on the video. Okay, and where am I poking you?
Left arm.
And
Sharp
it's sharp.
pain.
Okay, good. And then you're going to do the lower extremities as well. Where am I poking you?
My left leg and dull.
Okay. And once again?
Right leg and sharp.
Sharp. Okay, good. So sensation is intact, so that is good. The next thing we're going to go over is something called stereognosis. What I'm going to do is I'm going to put two objects in your hand, and you're going to let me know while I'm trying to decipher what the object is, okay? And then let me know what hand also I put it in as well. So keep your eyes closed. Okay. And
Left
what
hand.
Okay.
And it's a key.
Okay, good. And then
Left hand, coin.
good.
Right hand, coin.
Okay, good. Perfect. So stereognosis is intact. The next thing we're going to go over is gravesthesia. We're going to check, this is a little bit different. It's not an actual object, but we're going to go over, it's me imagining an object. So I'm either going to draw a shape or write the number 3 in your palms, and you're going to let me know which one's which. Okay, so first, and let me know which side I'm doing it on. So go ahead on this side.
Right hand, and it's a shape.
Shape, okay. And this side.
Left hand, and it's a 3.
Okay. Let me do it one more time.
Left hand, and it's a shape. Right hand shape.
Okay, so gravesthesia is intact as well as stereognosis. Mental status was completed. Patient's physical exam of the head, neck, a breast exam that I demonstrated, the self-exam, and then of course the neurological status. And so I think we covered everything.